People in southern Ontario and southern Quebec are getting ready for a hot and muggy weekend, and in some parts, this one could be a record breaker. Temperatures in southern Ontario are set to soar into the mid-30s tomorrow and stay there. With the humidex, it's expected to feel more like the mid-40s. And in Quebec this morning, heat warnings are in place in and around the Montreal area. Let's check in with Chris Murphy now at the Weather Network. He has more on what we can expect.
Well, no doubt about it, a heat wave is coming, and we have a heat dome to thank for it. So what the heck is a heat dome? We're talking about high pressure in the upper atmosphere, and it acts like a cap or a dome, and that traps the heat, and that can promote a heat wave. And that's what's going to happen Friday and Saturday particularly. That's all desert heat, all that heat right there. Temperatures in Arizona have been over 115 degrees Fahrenheit, by the way, and this will also grab humidity from the Gulf of Mexico. So the heat and humidity are stronger than it has been earlier this week. Let me show you some examples. And Friday and Saturday, those are the critical days. Windsor, mid-30s, feeling like 47 before things start to settle down back to seasonal next week. Toronto, Friday and Saturday, 33-degree temperatures, humidex in the mid-40s, and Montreal, low 30 temperatures, low 40 humidex. So bottom line is you want to find lots of shade, find lots of AC, and for goodness sakes, please don't leave any children or pets in the vehicles.
And with the heat of summer really setting in across the country, we've invited a doctor on the show today to talk about the health risks of those high temperatures. Dr. David Kaiser joins us from our studio in Montreal today, where that heat wave is hitting, and he's a public health specialist at Montreal's Public Health Department. Welcome. Thank you for joining us from a health perspective. What's the biggest concern as a doctor during a heat wave?
Yeah, so our biggest concern is really people who we know are more vulnerable to heat, and those include the elderly, but it also includes people with some chronic diseases that are very common, like diabetes or heart disease or lung diseases. Includes people with some mental health issues, especially people who are taking medications, for example, for schizophrenia, and obviously includes the very young. And we know that children on the age of 4 are less able to express thirst, for example, or to recognize some of those signs, and so they're also at risk. But that's really what is of concern to us during a heat wave, because we know that those people, especially when there's a couple of days, or right now we have a forecast of about 3 days of hot weather during the day and hot weather at night, we know that those people have more difficulty dealing with that heat.
Now let's talk about the hot weather at night. That is because it continues on into the night. That's some of the dangerous heat, correct?
Yeah, exactly. So it's important to recognize that there are two kind of categories of health impacts from heat. One of them, I think we kind of recognize is heat stroke, right? So a marathon runner on a hot day gets dehydrated, the body overheats, and that's a really dangerous medical emergency. But thankfully quite rare, and really isn't what we're talking about in a period of heat like we have right now. What happens to people with chronic diseases or the elderly is that they get slowly dehydrated, and it kind of just, the heat exhausts the body's capacity to deal with that, and that's why people get sick and people can die. And one of the really important issues is how hot it is at night, because you can have a hot day, we can have days at 30 with high humidity, but if the temperature at night goes down to normal temperatures, let's say between 12 and 15 in a lot of our cities, then people get a break from the heat, and that risk is much less. But in the next few days, what we have is temperatures that are projected to be 20, 21, 22 degrees at night, and so people aren't getting a break. And in apartment buildings, for example, or in the middle of big cities, it can be quite a lot hotter than that indoors, because everybody, I think, has experienced the fact that when you have a hot day, that heat stays for a long time inside a building. And so you can have temperatures 27, 30, we've measured 35, 40 inside buildings at night, and that's where there's really a big risk for people. Also because they're more likely to be alone at home and not have the help that they might have during the day if they have symptoms.
And what are some of the symptoms, some of the signs from someone experiencing too much heat?
Yeah. So as I said, heat stroke is a medical emergency, and the symptoms and signs are really for severe heat stroke are dry skin, confusion, people can lose consciousness. You call 911. for people who are experiencing what we call heat stress, or who are experiencing more the kind of slow impact of heat during a period of several days of hot weather, are not that specific, and often it's related to dehydration, so it can be feeling lethargic, so feeling tired, just not having much energy, but there aren't necessarily clear signs, and that's why I think the important part is prevention. So one of the things is drinking water regularly and getting a break from the heat is really the messages we put out there. But the second thing is, to the extent that people have family, friends, neighbors around that are checking on them, any kind of change for the worse in somebody who we know is vulnerable should be taken care of, because there aren't necessarily dramatic signs before people really become at risk for more serious impacts.
Now, you mentioned some ways to deal with the heat, but what are some other practical things people can do?
Yeah, so I think the really important message starting out is that people who are most at risk, maybe those who are least able to kind of follow the suggestions that we give them. So people who are living alone at home, who may be elderly, who may be less mobile, they need help to get out of the heat at least a couple of hours a day. They may need help to remember to drink water regularly. What we're looking at, and there's some research studies going on right now, is, you said practical tips, is what are the best ways that people who don't necessarily have access to air conditioning or who can't easily get out to a cool place cool themselves. But I think there's some things there that we can recommend that are fairly logical, and one is taking a cool bath or a cool shower a couple of times a day. So that just allows the body to get the heat out. Second thing is, if you have a fan, when it's really hot and humid, a fan doesn't do the same thing as an air conditioner, but putting a frozen water bottle in front of a fan, for example, to get some cool air blowing through. And the third thing is just a cool washcloth. So again, the idea is that putting that on the skin allows the body to get heat, transfer heat away from the body, and so a cool washcloth on the forehead or on different parts of the body several times a day, as often as needed. Those are some easy things that people who don't necessarily have access to other things can do.
Some really good advice there. I want to thank you, Dr. David Kaiser, for your time today. Dr. David Kaiser is a public health specialist at Montreal's Public Health Department in Montreal. Thanks for your time.
Thanks. Have a good day.